Welcome to our channel, Hashmi Clinics.
All right, clinicians, students, welcome. Today we're going to do a deep dive into one of our most indispensable acute remedies, Allium Cepa. You know, it's amazing that from the humble red onion, we get a remedy picture that is just so incredibly clear, so precise, it really becomes a cornerstone for how we understand acute catarrhal conditions. Okay, let's jump right in with the single most important keynote. This is the central axis that the entire remedy picture revolves around. Acrid nasal discharge, bland lacrimation. Think about that for a second. This polarity, this direct opposition of symptoms happening right next to each other, well, that's exactly the kind of strange, rare, and peculiar sign that Hahnemann told us to value above everything else. If you can lock this in, you pretty much unlock the whole case.
So here's how we're going to tackle this. We'll start with the essence of Allium Cepa, then look at the mind and general state, move into the characteristic local symptoms, and then cover triggers and modalities. After that, we'll compare it to some key remedies and wrap up with some clinical prescribing pearls to really sharpen your skills. Let's get started.
All right, section 1, the essence of Allium Cepa. Let's really get to the core of this remedy. What's the fundamental nature? What's the central disturbance it's really addressing? So what's the core identity here? Well, at its heart, Allium Cepa is all about a sudden, violent inflammation of the mucous membranes. It just unleashes this flood of watery secretions. You often see this in what we call phlegmatic constitutions. Think of those calm, easygoing patients. They're usually pretty robust, but man, when they get sick, they get hit with this overwhelming acute storm. That is the perfect setup for Allium Cepa. Okay, so what's its central action? It really produces this triad of symptoms. You've got the acute coryza, the head cold, then you often get laryngeal symptoms following right after. And then there's this very specific thread-like neuralgic pain. And the key thing, the thing that ties it all together, is that all of this is governed by a super clear, unwavering thermal modality. Okay, let's move on to the mind and general state. How does the patient actually experience this? Because as you can imagine, this level of physical intensity has a huge impact on their mood and energy. Mentally, you're not looking at a happy camper here. The patient is often pretty down, melancholy, anxious. This is not one of those, oh, it's just a sniffle kind of colds. They feel dull, they're sad, and they can get really worried, especially with this fear that the pains, that tearing cough or the nerve pain, are just going to become unbearable. Now for some key physical generals. First off, laterality. This is a predominantly left-sided remedy. You'll often see symptoms start on the left and then move over to the right. And you have to pay really close attention to this pain character. Patients describe it as being like a long thread. How weird is that? It's so peculiar, and that's what makes it a fantastic differentiating symptom. All right, section 3, characteristic local symptoms. Now we're getting into the nitty-gritty, the stuff that makes Allium Cepa so recognizable in the clinic. This is where the remedy really comes alive.
And we have to start with the nose and eyes, because this is where you find that defining polarity we talked about. This is absolutely the most critical diagnostic feature. If you can get this contrast right, you're already halfway to a confident prescription.
So look at this. On one hand, you've got this profuse, watery nasal discharge that is so acrid, so corrosive, that it literally burns the skin. It leaves the nose and the upper lip completely raw and red. But then, at the same time, you've got tears streaming from the eyes, just as profuse, just as watery, but they're completely bland. They don't irritate the cheeks at all. It's an incredible contrast, and it's the exact opposite of what we see in euphrasia. That's a distinction you absolutely have to remember.
Okay, what often happens next is that this inflammation travels, it descends, and it descends rapidly, right from the nose down into the larynx. And what that produces is a really characteristic, violent, and painfully acute cough.
This quote says it all, doesn't it? The patient feels as if the cough would literally split and tear their larynx. This isn't just a tickle. It's so violent, so exquisitely painful that you'll see the patient instinctively grab their throat. They're trying to hold themselves together against this awful, splitting sensation. If you see a patient do that, Allium Cepa has to be at the top of your list.
But it's not just about colds. Beyond that classic coryza, you need to remember Allium Cepa for some other really key things. For instance, this very unique catarrhal headache that stops during the menses and then comes right back after. Also, its powerful action on nerve injuries. We're talking traumatic neuritis, even neuralgia in a stump after an amputation. And then there are these very specific digestive triggers for colic, like getting your feet wet or eating cucumbers. Don't forget its use in penetritium, or whitlow, and for feet that get rubbed raw really easily, especially the heel.
And here it is again, that amazing keynote for the nerve pains. It doesn't matter if it's in the face, the head, or in a post-amputation stump, the patient describes the pain as being like a long thread. It's such a specific sensation, and when you hear it, it should be like a big flashing sign pointing right to Allium Cepa. Okay, let's talk triggers and modalities. And let me be clear, understanding these is absolutely essential. You cannot prescribe Allium Cepa correctly without them. These conditions of what makes things better or worse, they are non-negotiable for a solid prescription.
So what kicks this whole state off? The etiology is usually pretty clear. We're looking at things that arise from exposure to damp, cold winds or just getting your feet wet. But it also covers ailments from overeating certain foods, especially cucumbers and salads. And as we mentioned, it's a big one for trauma to nerves from surgery and for certain types of hay fever, like from the smell of peaches or flowers.
Now, if you remember only one thing from this whole presentation, let it be this. The Allium Cepa patient feels miserable in a warm room. Absolutely awful. Things get worse in the evening, too. But they feel so much better in a cold room or out in the open air. This relief is distinct, it's undeniable. This thermal modality is everything. It's paramount.
Okay, time to compare some key remedies. This is all about differential diagnosis in practice. And when you've got an acute coryza with stuff pouring from the eyes and nose, the number one remedy you're going to be comparing with Allium Cepa is euphrasia. They are like mirror images of each other, and honestly, confusing them is a really common mistake. So let's make this distinction crystal clear.
Here you go. This table is your clinical cheat sheet. It really is this simple. For Allium Cepa, think acrid nose, bland eyes. For euphrasia, it's the exact opposite. Bland nose, acrid eyes. And then you have the modality. The Allium Cepa patient feels better in the cool open air, while the euphrasia patient, especially with their cough, can actually feel worse in the open air. The discharges are total polar opposites. You just can't mix them up.
And finally, Section 6, our clinical prescribing pearls. Let's take everything we've talked about and distill it down into some practical tips that you can use to apply this remedy confidently in your practice.
So before you prescribe, I want you to run through this mental checklist. First, confirm the polarity. Is that nasal discharge acrid, and are the tears bland? Yes or no? Second, verify the modalities. Is the patient really worse in a warm room and better in the open air? Third, listen for those keynotes. Are they mentioning a tearing cough or those thread-like pains? And fourth, check the cause. Did this all start after getting their feet wet or being out in a damp, cold wind? If you can tick these boxes, you have a very, very strong Allium Cepa case.
And that brings us to a final, really crucial thought, especially for your chronic cases. When might we miss something deeper? Think about recurrent hay fever. Allium Cepa is brilliant for that acute episode, no question. But we have to ask ourselves, what does it mean when that same pattern comes back, year after year after year? That recurring susceptibility, it's pointing to something deeper, an underlying psoric miasm. So while Allium Cepa is our acute tool, our ultimate goal is always to find the constitutional remedy that gets to the root cause. We want to move beyond just palliative care for the acute flare-up and really aim for a true cure. And that, right there, is the real art of our practice.
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.